Good afternoon, and thank you for joining us. Welcome to our Student Parent Town Hall. My name is Jim Duffy, and I am an Associate Dean in our College Life office. I will be moderating today's session. Please know that we are recording this session so that we can make it accessible to those who could not join us today. Our aim for this town hall is to provide important information about our return to campus and to answer your questions. Various Gettysburg College employees and our health consultant are joining us on the call today. To begin, I'll introduce each panelist. Once all panelists have been introduced, I will ask each of them an opening question, followed by questions that were submitted in advance. We will also be taking questions from the audience. Please submit your questions through the Q&A feature. We will do our best to get to all questions, but if we do not, please continue to send your questions to fallreturn@gettysburg.edu. and visit the college website for the most up-to-date information. Let's get started. We are pleased to have 6 panelists joining: Associate Vice President of College Life, Judy Williams, Director of Health Services, Peter North, Executive Director of Auxiliary Services, and Jim Biesecker, Executive Director of Facilities Planning and Management. We'll begin with Julie. Julie, to open up the session, the college has sent out a lot of information in the past few weeks. Can you talk briefly about some
Okay, Jim.
of the plans to date and what students should be focused on now?
Sure, I'd be happy to. So, good afternoon, everyone. I'm Julie Ramsey. I'm the Vice President for College Life and Dean of Students. And contrary to how it may appear, I'm not on a beach. I am at home and have been working from home like everyone else for many months. And I'm so excited to be able to talk with all of you. I've been corresponding with many of you, trying to answer questions. I know you have a lot of questions. We're going to get to those. But let's start with sort of a high-level view, and then we'll get into some of the more important details for you all. So I would say that the thing that has been going on here, what's been going on here, the college has taken enormous strides to make this campus ready for your return in the fall. And we have had to reimagine just about everything that goes on at Gettysburg College, whether that's dining or classes or residence life or social life, etc. There have been so many innumerable details and changes and questions and discussions. And all of that because of really, well, I'll say 2 things that have been our guiding lights through this entire process. The first is that we've heard loud and clear from students and faculty and parents that they want to be back together, that they want to come back together to learn, to study, to grow, to meet new people, etc. We also believe that this is the best kind of education available. This is our mission, to provide residential education. This is who we are. This is what we do. And the main caveat, of course, is that that's what we want to do if it can be done safely. And that is the critical phrase now to the sentence, and the one that we have been considering very strenuously for the entire summer. So how do we do this safely? Experience has shown that if people wear masks, practice physical distancing, and practice good personal hygiene, that this situation can be far more manageable than if not. So those really are the critical components of what we will all need to be doing when we return to campus in the fall. We know that this won't be a sterile environment. There's no way that can be the case. We don't have a moat around the campus. We don't have a fence. And we know that this is a highly transmissible virus. So we know it won't be sterile. There's a good chance that there could be, and probably will be, cases of the infection on campus at some point during the semester. Our job really is to detect those cases as quickly as possible and to try to prevent any further spread. And we're going to need each and every one of you involved in helping us do that. So what has the college done to prepare in this, as I said, to open safely? Well, testing is a big part of that. We've sent you lots of information about that. We can talk more about it. But again, I'll just summarize. We will be testing every student on the way in the door, and we will test every student again within a couple of weeks, within some days after the initial move-in. We have asked you to self-quarantine, if at all possible, before you return to campus. That's not possible for everyone, but if it is, that's what we would like you to do. We'd like you to start the daily health screening, and hopefully you've done that. We've asked you to sign and return the health agreement, and you should, I think the vast majority of you have done that by now. We're going to ask you to, as I said, wear masks, physically distance, and practice really good personal hygiene throughout the course of the semester. The key thing here is we really do need everyone's cooperation to make this work. We've tried to give folks choices. You have choices about remote learning. You have choices about being a commuter, and some of you anyway that live a little more closely to campus. And we want to support you in making good choices for your return to campus. We will ask you for your patience. As I said, there have been a lot of changes, and it'll take us some time to, I think, get used to those changes. And I guess I'll just say one last thing. Prepare to spend more time outside, because those of you may not know yet, but there are a number of large tents going up on campus so that we can spend more time both in classes and in clubs, organizations, etc., in under tents. And we will be spending more time outside this fall. And actually, I have to say that's one of the parts I'm really looking forward to. But I am looking forward to having all of you back. As I said, we're very excited. And I'll just stop there, and Jim, kick it to someone else. And we'll circle back to any questions folks have.
All right. Thank you, Julie. The next question is for Rich. Rich, can you tell the community a little bit about your background and the role you've played with the college over the past few months?
Sure. Good afternoon, everyone. Nice to be with you. Thanks for joining us. So my name is Rich Keeling. I'm the chairman of Keeling and Associates, company with my name on it that I formed about 21 years ago. I'm a physician, and for 25 years, I was a professor of medicine and I was in charge of all the on-campus health-related programs for students, first at the University of Virginia, Charlottesville, and then at the University of Wisconsin-Madison. Because of my subspecialty training, I'm internist with special training in hematology, immunology. I got very early involved in care back in the 1980s of people with HIV, which led me to some leadership roles nationally in confronting that epidemic on college campuses. And since forming the company, we've worked with lots of institutions dealing with infectious diseases, become a kind of specialty of our firm. And the public health folks and me who work with Keeling and Associates have been working with Gettysburg to try to ensure that the planning privileges first and foremost health and safety of students, faculty, and staff.
Thanks, Rich. I've been informed that there are still people joining, so just to catch those up who have just joined, we have a number of panelists joining us today. I am your moderator, Jim Duffy, and if you do have any questions, please feel free to submit them through the Q&A function. My next question is for Jeff. Jeff, many students have been interested to hear more about what move-in will look like. Can you highlight for everyone what will be different from this move-in and what students should expect?
Yes, Jim, thanks for the question. Again, my name is Jeff Foster, Associate Vice President of College Life. And for those of you who are returning to our community, this year's move-in will be different. And for those of you who are new to our community, just know that things will be quite different. We'll get into some of the details as the call goes on. But as you've read in your communications, and as Dean Ramsey just said, we will be testing everyone when they arrive on campus. And that will essentially be step one in the move-in process. People will arrive, go to the Jaeger Center for testing. After testing, you'll get a key and then move into your room. As you've read in the communications that we've been sending out, the move-in will be different. We're asking people to move quickly, to pack lightly this year. we're asking people to also just bring one person with them to go into the building at a time. So things will be a little bit different with the move. And again, this is all premised on the idea that safety is what we need to be thinking about, the health and well-being of everyone first. So when you arrive at your building, things will be different there as well. The same rules that we've been talking about: mask use, 6 feet of distance, and making sure that you're practicing good hygiene will apply in the residence halls as well. One exception is when you're in your room and you're in your room with your roommate, you do not have to wear a mask at that time, but otherwise those rules will apply. I do encourage you, in terms of move-in day, we are trying to, again, get a lot of students in a relatively short period of time. Typically, first-year move-in is approximately 4 hours. It's going to be 2 days this year. Returning student move-in is usually 2 days. This year, it's 4 days. The goal being that we have to spread people out, bring them in shifts and in waves through the testing process first. So again, the move-in process will be different. That's taking more time in order to, again, support the safety of everyone. Once the testing piece happens, there will be a quarantine period, as you've read. We are working hard here, our orientation staff and others, to make sure that while students are in quarantine, that there are opportunities, to engage. We're pulling together a number of online and virtual experiences for students to talk with their RAs, to talk with members of clubs and organizations, to get to know people on campus as best we can under quarantine conditions. Once quarantine conditions end, or once a student is no longer in quarantine for testing, we will begin, especially through the orientation process, try to gather people in small groups outside for activities. Our staff is still finalizing the details of that. We are working very hard to make sure that we can offer an orientation experience that's welcoming to the new members of our community. We've received a lot of questions about what to pack and how to prepare to come to campus. And again, we've talked about packing lightly. And what does that mean? Well, it means bringing the things that you need to bring. Maybe if there's something large that you might have brought, leave that at home this year. One question we get a lot is about rugs. And again, rugs are very important to a lot of students, but this might be a time to not think about bringing a rug, or to bring something smaller. We've also heard a lot of questions about this essentials or this to-go bag that we've put into our materials as well. Again, the point there is that we want students to be able to grab their essentials. Should we have to move someone quickly, or if we have to make a change quickly, the students are positioned to do that. Have some personal items, your computer, your books, etc., and ready to move somewhat quickly. So those are some of the things that are going to be different about what you'll see this coming year. And if there are other questions, happy to answer those down the line.
Thanks, Jeff. Judy, the next question is for you. Can you tell us about how the health center is preparing for the return to campus and what changes are being made?
Sure, I'll be glad to. Again, I'm Judy Williams, the Director of Health Services. We've been working very hard since the beginning of this process to make sure that the health center and the campus are as safe as they can be. We've been able to hire more people. Therefore, after our testing process, mostly in August, we'll be expanding our hours and be offering some Saturday hours, which is a little bit different for us. So, and we'll be stretching out our visits so that our well students will be seen in the mornings and our ill students will be seen in the afternoon. So we're trying to separate out well and illness, as a lot of physicians' offices will be doing. We've also acquired an appropriate amount of PPE. That's always a challenge for anyone in healthcare at this time, but we feel very confident that the amount that we have right now will be sufficient for at least several months. So we've created 2 negative airflow rooms, and that may or may not mean much to a lot of people, but it really is a great investment in the college to having a safe place to test students inside a building for COVID-19. And it is also reflected in a lot of your in-hospital patient rooms. So we are lucky to have that investment by Gettysburg College for us. We'll be initiating the contact tracing team next week, and all our contact tracers have been certified through Johns Hopkins contact tracing program. And our contact tracing team will not only be working with students, but also be interacting with staff and faculty that may become in close contact to the student. So we're kind of trying to work on both sides of the campus community to ensure that we're creating a safe environment. I think that's, we also have set up a daily monitoring system that I believe right now most students are working on their pre-arrival symptoms, which really are, it's a way to trigger further assessment at home if you're having symptoms, so that you do come to campus, either tested and then you have to stay home for a little bit, or you come to campus well. When students arrive on campus, that testing will then change to a daily COVID, my COVID status. It's similar to some of the apps that you'll see out there, whereas through the Medicat electronic health record, the students will be doing a daily check, self-check, and will actually be getting a green, yellow, or red, depending on what symptoms or responses they give. And that tracker, you will be able to show that. We've been asked, especially by our athletic team that will be doing some early practices, to have some assurance that students green to go. So we have that. Again, that's a new system for us this year. I think that's where the key points, but I'm sure there's other questions for me, but I'll move on to someone else at this point.
Thanks, Judy.
Yep.
All right, Pete, you're next. Can you share with us what type of changes students can anticipate when it comes to dining on campus?
Sure. Good afternoon, everybody. My name is Peter North. I'm the Executive Director of Auxiliary Services. Dining is one of the areas that's in my portfolio, but so is the college post office and bookstore, and we'll get to some of those as well. Well, Julie mentioned that we were reimagining the campus, and we've been redesigning dining in that same vein. We have a long history of a strong food service program, but very strong in sanitation and safety as well. And so we've taken that opportunity to redesign a lot of the dining venues with safety in mind. And I think one of the challenges that we're going to have is that we tend to get very crowded at very peak meal times. Students will see that we are social distancing. You'll be asked to keep 6 feet apart. Our seating has been reduced, probably even more than the governor is recommending for average restaurants. They're using a 25% measure. Here, we'll ensure that all of our seats are 6 feet apart unless there's a physical plexiglass barrier, which we'll be installing some of those. So unfortunately, our students who are very social and use dining as a social gathering, we'll have to do that from a distance this year. But it's all done with safety in mind. A lot of the foods will be prepackaged and taken out or served to you. We want to maintain the integrity of that program. And then if there's seating available, glad to have you. If not, feel free to take it. They're all designed to be reheated and enjoyed at a later time if need be. We have some additional seating. There's, Julie mentioned, a large tent on Memorial Field. We have some more patio seating. The ballroom, plank gym will all be set up as additional seating. And we'll have some additional foods available there as well. But I did want to take this time to mention about the post office, because that's also a big pinch point, especially for the first 2 weeks. If you can bring items with you or have them shipped home and brought to you, that would be very helpful. We did implement touchless kiosks, so that those transactions are touchless now. And there is social distancing, and please don't just come in and see if a package has arrived for you. Please wait until you get an email from the campus post office from R. Bennett. Then you'll know that it's here and ready to be picked up. But I'm sure there's a lot of questions that we'll get to in a minute.
Thanks, Pete. I appreciate you covering the post office there as well. Jim, the next question is for you. Maintaining a clean environment is an essential part of the campus return. What type of changes are facilities making to their cleaning regime?
All right, thanks, Jim, and thanks for everyone for joining us this afternoon. I'm Jim Biesecker, Executive Director of Facility Services Planning and Management here at the college. And yeah, it's been mentioned so many times already. I mean, a lot of changes are happening on campus. Cleaning and disinfecting common areas of the buildings is obviously essential for a safe living and learning environment for our students and our employees. Providing safe buildings, following the CDC guidance has been a standard practice in our process for years. But as the pandemic came on, we've implemented enhanced cleaning schedules to all campus buildings. Residence halls with common spaces and shared bathrooms will be cleaned and disinfected 7 days a week now. Larger residence halls, residential facilities, will receive a second disinfecting service daily as well. Disinfecting high touch points, and those are the door handles you come into the buildings, the bathroom fixtures, light switches, flat surfaces, hand railing, laundry equipment, anything that can be touched the common areas in a building are what we call high touch points that will be receiving the daily disinfecting twice a day in those buildings. Academic spaces fall into that same schedule changes, daily cleaning and enhanced disinfecting schedules. Classrooms, labs, and meeting rooms will also have disinfecting wipes and hand sanitizers in every classroom, every space. The disinfecting wipes are to be used by the students and by the faculty. So if we're cleaning those spaces twice a day, as students and faculty come into the offices, into the classrooms, they're being asked to wipe down the spaces as well. So grab a wipe from the container, disinfect the desk you're going to sit in, the solid surface, and clean your space before class begins. Each building's also equipped as you walk in hand sanitizers at every entrance. That's every one of our facilities. As you walk in, you'll see them either on a wall or a pedestal as you come into the space. And I think the key point you're going to keep hearing, I mean, as we prepare these spaces, I mean, it's up to all of us, employees and students, to work to keep a safe and healthy environment. And we're here to help you and assist you do that.
Thanks, Jim. A quick follow-up to your comments. What changes have been made to better accommodate physical distancing on campus?
Yep. Once again, a lot of changes. You're going to see those as soon as you walk into the space. Classrooms, dining, library, building lobbies, lounges, you name it. We've seen capacity reductions. The furniture's been removed. Spaces have actually been set, so you'll see floors marked where if someone happens to move the desk chair from the one class to the next, you'll know where it goes and how it goes back into place. We've installed plexiglass barriers in the classrooms. They're movable for the faculty. You'll see that all around campus in transaction areas. Signage, a lot of signage is going into buildings, directing traffic and flow in and out of buildings and down hallways. How many room occupancy capacity in every room is going to be posted, so you know how many should be in the space. If you're wondering when you get in there, looks like there may be too many, you'll know when it's on the wall. And social distancing means signage has been mentioned. All around campus. Wear your mask, wash your hands, monitoring your symptoms. I mean, those things you're going to see frequently as you walk into the buildings. In addition to the classrooms and the academic spaces and administrative spaces, we reduced density in some of the residence halls, mainly the first year buildings, but they were more of a focus of trying to reduce the amount of students to a fixture in a bathroom. So we've reduced those, so we may have less students in some of our buildings. So
great, thanks, Jim. Judy and Rich, I want to turn to you. There's quite a number of questions about testing, so I'll start with you, Judy. What is the college's testing plan, and how often will we test students?
Okay. That's a good question, Jim. To start out, every student will be tested as they come in. As Jeff explained, the new process will be get tested. We'll be coming in through the Yeager Center. We'll have the gymnasium set up, and we'll have a number of our staff, along with the athletic trainers, that will be in full PPE and doing oral pharyngeal testing, which is essentially the test is very similar to a strep test. And from that point, this testing will be picked up by a courier to the lab that we're using, and we're anticipating a 24 to 48 hour turnaround time. The testing plan is then to be looking at students that may be at risk or come from hotspots, to test in between, and then repeat the full baseline testing towards the end of August. So our goal is to, obviously, we may not catch all the positives in the first testing. We anticipate that we will catch some positives, and that's a good thing, because then we can certainly isolate the positive students and place them in and their contacts in a quarantine area. So that's the plan. We also will be doing surveillance testing. That's where you take a certain percent of the population fairly frequently, or to see if there's any clusters of positive cases. We'll be testing outside of our testing plan about 100 students every week through the surveillance testing. So that's the plan right now. We feel very confident we have test supplies to accommodate our plans. So.
Thanks, Judy. Rich, we've talked quite a bit about in the opening statements, or the panelists have discussed quite a bit about how the college is planning and preparing for the arrival of students. Can you speak from your perspective on the college's planning and preparedness?
Sure. Thank you, Jim. The Gettysburg has been extremely diligent and taken this planning work very seriously. And that means to me, as an external person, that the college has first thought about the reasons that there's risk for transmission of COVID-19 in higher education. And some of those are the things you've heard about from Julie earlier about the very nature of this terrific education at Gettysburg. It's residential, which means people live together, they see each other a lot, there's a lot of contact between students and faculty and students and staff. And all of that kind of engagement is central to what Gettysburg is and what the education produces. That has meant that it's necessary to set some pretty clear prevention goals and then to put in place all the risk mitigation steps that you've heard about from some of my colleagues here over the past few minutes. The goals are to prevent infection all the time that we can, to detect it as early as possible if it does occur, and then to contain it. And those goals are supported by a long list of risk mitigation strategies, which include things from de-densification, such as you've heard about from Jim, all the way to the testing, contact tracing, quarantine, isolation requirements that Judy was talking about, and to consciousness to prevent outbreaks. This is where there's a certain toughness about these mitigation procedures. It's clear that particularly among college students, the major source of transmission of COVID-19 is in large gatherings, particularly gatherings that happen indoors. So it's going to be essential, absolutely essential, over the course of this new semester that we not do that we not do it and for ourselves, that we not do it for the sake of the community. That is, in order for Gettysburg to stay open, for all of us to have a healthy experience, it's not going to be possible to have the kinds of gatherings, parties, events that we might be looking forward to as part of a college experience. Gettysburg is putting together lots of other options and alternatives, but that's going to be absolutely essential. When all of those things are taken seriously, we expect it can be a very healthy and safe semester, but still, the college has also taken seriously the possibility of having to change plans. So there are clear expectations related to certain events or changes in the course of the pandemic or things that happen on campus that might lead Gettysburg to decide to make some other decision, if not to go entirely back to remote instruction, perhaps to do some more different, more remote version, or to close a particular residence hall, or to stop having a particular course in person. All of those options might be considered. And the important thing is that Gettysburg has thought through those things pretty seriously. The last thing I'll say is that some advantages that Gettysburg has just related to geography. It's in an area in which there has not been a huge impact from COVID, understanding that any impact is painful, that any impact takes away people we love and care about. But here in Adams County, the numbers of cases has been about half on a per 100,000 basis than across the rest of Pennsylvania. The rate at which people die in this county is lower than the rest of Pennsylvania. And the rate at which people test positive when these tests are done is lower in Adams County than in the rest of Pennsylvania as well. So there's some advantages here that we want to take carefully, not brag about, but be sure to take advantage of. It means we have the opportunity through good physical distancing, mask wearing, avoidance of big gatherings to keep it that way, to make it possible to stay that way. You've seen a lot of changes in our country over the past 5 months since March, and those changes tell us one major thing, which is that we understand the patterns of transmission of this virus very well. And the recent surges, the recent changes, the acquisitions of COVID among some college students just reinforce that. They tell us that what we think we know is what actually is happening. And they also tell us what we know about prevention is actually how to prevent it. So trying to prevent it carefully. I'm going to say it again. Masks, social distancing, avoidance of big gatherings. That's all of our obligation to each other.
Thanks, Rich. Julie, I'm going to turn to you. Rich talked about obligation to one another. He also talked about cooperation of the campus community. You sent out an email with the student pledge that outlined some of these expectations of cooperation. Can you talk a little bit about how the pledge will be enforced, and does it apply to those living on and off campus?
Sure. I think the first step really with enforcement is always education. So if you read the letter that went out a week or so ago, you'll see that it tries to explain at the very outset what's at stake here and why this is so important. I think if people are being asked to follow new regulations, new requirements, it's important for them to understand why. And I think Rich has laid that out very, very well. The letter also talks about essentially, this whole process depends upon, as we've been saying, the cooperation of everyone. We cannot be successful unless students really, really participate fully and agree to do the things that we've asked them to do. So I think the letter and hopefully other conversations we'll be having with students will help them understand why these things are so important. And starting with the premise that this is voluntary on their part. They're returning to Gettysburg because they want to be here. And if they, if we can't do that, there are going to be consequences both for the community and for individuals. So if we can't if we can't maintain social distancing, et cetera, and the infection rate is higher than we would predict, or we feel like we can't do the things that Rich mentioned, then it puts the whole semester in jeopardy, quite frankly. So we've laid out that consequence. We've also laid out the consequence of individual, the possibility of individual consequences, so that students who are egregiously or repeatedly violating what we've asked them to do, they could be sent home, they could be suspended, they could be, and there's a variety of things. We don't want to do any of those things, quite frankly, but we have to do those things, as Rich mentioned, to protect the community. So there will be, I think, when students arrive, a very clear set of a rubric really that lays out for students what the likely consequences are going to be of particular violations. But I always feel like it's just easier to engage people's cooperation and to help them understand why these things are so important. And that's what we'll continue to do that, as well as to work with individual students.
Thanks, Julie. Jeff, I want to follow up to Julie's comments with you. Can you just briefly talk about the cooperation we're looking for, and perhaps what the expectation looks like for any social events that might be able to happen?
Yes, that's a good question, Jim. Thanks. As was noted in the health agreement that went out to all students, we do have to greatly limit gatherings of people on our campus for all the health and safety reasons that Rich mentioned and that Julie mentioned as well. So for this coming year, in this aligns with the state of Pennsylvania's guidelines as well. 25 people is the limit in terms of people being in a space together. Also in support of this, we're not going to be supporting this year registered events of any type, and that's for clubs, organizations, and groups on campus. In the college, the Student Activities Office, and others who typically would sponsor events, we're not going to be sponsoring those types of events this year, larger events, certainly no events with alcohol. So there will be some significant changes to the social life on campus. All that said, the staff and student activities, religious spiritual life, campus rec, OME, others are working very hard to pull together a student experience that is going to continue to complement the classroom experience here. Because again, as a residential college, it is important to remember that the out of class and the interactions with others are critical. And so we are working as we did in the spring, but continuing to build on that to try to offer things both virtually and when we can in person. So social life will be a bit different, and we're working to reshape that. This will require the cooperation of everyone. Again, we're trying to give students an opportunity that if there are informal gatherings that happen in common spaces or lounges, that we want people to be able to do that as long as they are wearing masks and they're 6 feet apart. We want to support that. But we certainly we can't support students gathering in groups larger than 25, and certainly we will not be supporting events with alcohol.
Thanks, Jeff. I really appreciate that. Pete, I actually want to come back to you. We're going to pivot back to food again. We're getting quite a few questions about food, and I want to do kind of a rapid fire, if you will, some brief questions, maybe a collection. Sure. If that's all right with you?
Sure.
So here we go. Will all the dining locations be open?
Yes, all the dining locations are on track to be open, and we actually are in fact working on adding additional outlets to obtain meals. We'll have additional seating, like I said before, in the ballroom, but we'll also have some food available there as well. I know there's some, and I'm going to anticipate a question, students living up at the Gettysburg Hotel. We just finalized an agreement with them to provide meals for students as well. Starbucks will be open, as well as, and I think it's still going to be one Lincoln, but I'm not sure where they're going to do all of this. Students will have the opportunity to use their meal program, their meal card up there as well, a meal swipe, as well as dining dollars and bullet bucks. So that should be another addition for students, especially the ones living up there. Again, please keep in mind the social distancing. Their seating will be, again, 6 feet apart as well. So it's going to look different than other restaurants on the square. What else we got?
No, I think actually you covered 3 questions in one, so I sincerely appreciate that. I'm going to ask the panelists. We've been talking now for about 40 minutes, and questions continue to come in. So I'm going to ask you to shorten up the answers a little bit to see how many of these we can get through. We've got quite a few questions coming in today. Pivoting away from food, that's one area where students don't have to wear masks. But Rich, here's a question for you. What is considered an appropriate face covering?
Appropriate face coverings are the cloth masks that we have all mostly gotten used to in our own lives over this past 4 months. That means the appropriate face covering does not include something that leaves gaps on the sides of the face. So it doesn't include bandanas. It does not include face shields, which you've sometimes seen people talk about. It also does not include masks that have a clear plastic piece in the middle that actually interferes with its functionality. And finally, there's no need to use actual medical surgical masks. There's no need to use the so-called N95 respirators. What we need is just the plain, ordinary, washable cloth coverings that we've been using.
Great. Thanks, Rich. Julie, we actually have a question about the local hospital. Is the local hospital equipped to help with sick students?
That's a great question. I happen to be the president of the hospital board this year, so I've got I don't know what I was thinking, but that's the case. Yes, they are part of the WellSpan system, and they have been planning, as any hospital system would be, for and modeling projections on what they can handle and how they handle it. And they've been including the college in all of those projections. I meet with them on a monthly basis, and we go over COVID protocols repeatedly. So I was on the call this morning, and they assured me again that they have the capacity to do what is modeled. And again, that includes the college community. And of course, they have the capacity to, as a system would, to share or transfer folks, particularly those who might be extremely ill. So we've had a good relationship with them. About a mile of hospitals located about a mile away, for those of you who may not know that. It's a very close by and very close working relationship.
Thanks, Julie. Judy, I'm going to ask a similar question regarding medical treatment. What kind of medical treatment will students receive if they test positive on campus, and what will happen if their health declines rapidly?
Well, our plan is maybe we'll start with that positive test, and that would be a good starting point. The student will be moved to a hotel that's about a mile from the campus. We're using 2 hotels for our isolation quarantine students. They'll be moved to that hotel, but they'll be very closely monitored by our case management and nurse practitioner team. We have the capability of a daily assessment, physical and telephone assessment of the student that will be in that area. The students that will be placed in the isolation hotel, there's always someone at the front desk. So we have that support. Of course, we have our on-call system for support, and included in the on-call system this year will be the nurse practitioner on-call. So we'll be able to not only physically visit the student and do an assessment, we'll be contacting them by telephone, and we will then trigger our emergency system as we would with any sick student on campus, and DPS will become involved and call the ambulance transport as we've done before. So I think close monitoring, the student is going to find that we're going to be calling them. We're going to be knocking on their door and visiting them and just do a physical, because I feel very strongly that getting your eyeballs on a person is the most important thing. And it also will help the student to break down that sense of isolation, and will be able to intervene with other services that they may find are needed. We'll be also working with our counseling department to provide Zoom counseling for our students in isolation, if that's necessary. So again, all our normal support services on campus are available to that isolated student in one form or another. And again, the case management team will be facilitating that for the student.
Great. Thank you, Judy.
You're welcome.
We're going to pivot again here, and Jeff, I'm going to come your way. We're getting a number of questions about move-in. So much like my earlier question for Pete, I want to ask you a few questions here back to back, if that works for you. What will students receive when they arrive?
It's a good question. Each student will receive an arrival packet. In that packet, we will be providing a small amount of hand sanitizer, some sanitizing wipes, a map of campus dining options. Those are things that we will provide. I do encourage students, however, to bring, if you have hand sanitizer, personal supplies of those sorts of things, please feel to bring those with you as well.
Thanks.
Jack, here just a second, if you don't mind. If you can find thermometers and send them along with your students, that would be important. For our students that will be in quarantine and isolation, health services will be providing some, but they are in limited supply. So we are having difficulty in finding them. So if you have an electric, I guess they're electric, battery operated thermometer at home, that would be super. So thanks.
Probably most importantly, Jim, I forgot to mention 2 cloth masks will be provided as well.
Thanks for clarifying that. Jeff, will roommates be arriving at the same time, or is the plan to have them arrive at the same time?
Roughly, we're going to bring roommates in a similar time frame so that they can be tested and then quarantined together. We're trying to stagger the move-in time just a little bit, so a student moving in and their move-in assistant person, but they're not all trying to get 4 people into a room at the same time. So we're going to stagger the actual arrival slightly, but generally arriving at a very similar time frame.
Great. And one last question for you, Jeff, in this segment. This is a question about drop-off day versus actual move-in day. Will students receive keys who opt for a drop-off day and keep them until move-in?
No, students will not keep the key. For drop and go dates is what we're calling them, are August 4 to 6. Students can come to campus, get access to the room, move belongings in, and then depart campus. But we will be taking the key back at that time.
Okay, great. Thanks, Jeff. Julie, there's been a number of questions coming in about isolation and quarantine. This actually may be a question that you, Judy, and Rich may want to weigh in on. But can you tell us more about the isolation and quarantine procedures?
Sure. As I understand it, isolation is a term that we use to describe students who have tested positive and who are now placed in a private room with a private bathroom. So as Judy mentioned, these are the locations we have in mind there's a motel on campus and with a small number of rooms, and much larger motel about a mile away. So a student who is tested positive will, as I understand it, I should let my medical people probably talk more about this, but if I can explain it to you, that means I understand it. So students would need to stay in isolation for about 10 days until they have no fever and no symptoms. And that's part of that daily monitoring and on-care or on-site follow-up that the RN and care manager will be doing with the students. So that's isolation. Rich or Judy, why don't you do quarantine for us?
Sure. So isolation and quarantine differ in purposes and to a little extent in the process. So as Julie said, isolation is for people who have a positive test or have become sick and have a positive test. And there's the requirement that you stay isolated for the 10 days until things get better. Quarantine is different. Quarantine is where it's not clear whether infection has occurred or not, but there has been an exposure that could have resulted in infection. So quarantine often will get used because of contact tracing, such as Judy described. It means you've been within 6 feet of somebody who had the virus for 15 minutes or more, and a student who meets those criteria would be asked to quarantine. Quarantine, however, is not that different from isolation in its requirements. That is, you stay in a room, you use either a private bathroom or a particular set of fixtures in a bathroom that's shared by others. In both the state of Pennsylvania's guidance and the Centers for Disease Control, quarantine is taken very seriously. That is, you don't leave the room and walk around campus. You certainly don't go to classes. You don't go to other buildings or to the dining hall. And quarantine is in the interest of protecting everybody. So Gettysburg is going to take that quite seriously.
Thanks, Rich. I'm sorry, go ahead.
I'm going to jump in here too. And I will say that for our students, 2 weeks of quarantine on a college campus is very difficult. And so we will encourage students to go home if they're able to go home without using public transportation. Of course, we don't want to spread this outside our community as much as we can. And so that certainly is one of the options for both students that will be going into isolation and quarantine. We'll be communicating with parents or support people just to say, is this an option for your student? And it might be a very much more of a feasible option when you take into consideration the challenges of being in one room for 2 weeks. So.
Yeah, Judy, a follow-up to that. We just got a question about, since we're on the topic of quarantine, will students be quarantined every time they're tested? That's the question.
Well, yes. Perhaps Rich can speak to soft quarantine, but we're doing a broad baseline testing where we'll be getting the food will essentially be pick up and go back to your room, and will be that will be during our testing periods. I think a person that has been exposed creates a much greater risk than a student that's been quarantined. The quarantine for students in the testing period is to make sure that from the time they're tested until they get the results that they avoid becoming positive. It's about a kind of simple way that I think the student can understand that. We want to make sure that we're testing today and in the next 24 to 48 hours, they aren't exposed to someone and then are potentially a positive. So, yes.
Great.
But the hard quarantine certainly is for someone that has had direct prolonged exposure to a positive case.
Thank you.
Mm-hmm.
Our next topic we're going to pivot to is somewhat related to quarantine, and that's hotels. We're getting a number of questions about the hotels. So there's a question about clarification related to the Gettysburg Hotel versus the other hotels for isolation and quarantine. So Judy or Pete, could you just share, what the specific role of the Gettysburg Hotel is versus the other two hotels?
The Gettysburg Hotel, and I think a question popped up, it is an off-campus residence or an on-campus residence hall right now. So it's not for students who are isolated. They'll be living there. It's as a room assignment, as if it was a on-campus building. The other two properties are sitting vacant and available for our use to isolate students.
Thanks. I appreciate that clarification. And Jim, how are the getting back to cleaning? How are the hotels going to be cleaned?
The hotel is used for isolation. Is that the question?
I would say all three.
Yeah. The hotel is used for isolation and quarantine. Will actually be cleaned by the property owner. So they will maintain that and clean as students transition in and out. As far as the Gettysburg Hotel, that is still going to be cleaned and maintained by the Gettysburg Hotel staff. So they'll be taking care of that. But that's more just the common areas, not any cleaning of any of the individual rooms, but hallways and very similar to what I said earlier. High touch areas. If there are public bathrooms, they will be taking care of those spaces. And the space is being used for meals and supporting the student meal program.
Great, thanks, Jim.
So Jim, just for people's clarification, in the request for proposal submission, each of the properties had to submit a sanitation program that was that adhered to CDC guidelines. And so within our agreements with them, there's a whole exhibit that speaks to how these will operate, what the students should expect, what the expectations are of the college has for the hotel as far as trash removal, linens, towels, and all that, and housekeeping.
Great, thanks for that clarification, Pete. Jeff, staying on the topic of the Gettysburg Hotel in particular, students assigned to live there, the question is, what can they expect in regards to bike racks, parking, printing, what to bring, those types of things?
Great question. We're working, as others have noted, to get the Gettysburg Hotel aligned in terms of amenities as we have on campus in our residence halls. So specifically, students, it is a hotel style building. Students will be 2 per room with a private bathroom. Outside, we do have bike racks, has been a common question. There is a small bike rack behind the hotel. Jim Biesecker and his facility staff, we are looking to add bike rack capacity to the back of that building as we can. So bike racks, we're adding laundry facility to the first floor of the building as well, so that, again, just like on campus, the students have access to laundry facility. One difference is that the laundry facility will require coins. It will not take the campus card system, but the hotel desk will have coins available for students. Parking, students will need to use their campus parking permit and park on campus. The hotel does have a parking garage behind it, but that hotel is owned and operated by the Borough of Gettysburg, if not by the college or by the hotel. If students would like to, they can purchase a parking permit from the borough to park in the parking garage there, but otherwise students will have to park their cars on the main campus. And we're planning for parking, and we should have sufficient space. We will have sufficient space for the parking of the students at the hotel.
Thanks, Jeff. We're going to break away from the themes here. I've been notified, we've got about 10 minutes left. So we're just going to go through a list of questions here that have come in. They'll be a little bit more random, not as thematic as we've been progressing before. Jeff, I'm going to stay with you because we have a question about move-in. The question is, I understand only one parent can help with move-in, but what if both parents come? Can they swap out while the other one stays in the car?
The short answer is yes. We just ask that just one person enter the building at a time. Let me add one thing. I'm seeing a couple questions here about the hotel. Yes, there will be RAs at the Gettysburg Hotel, and yes, there will be security there. Public safety will have responsibility for that building, along with some contract security that we're working on. So I do want to assure everyone that we will have staffing and security taken care of at the Gettysburg Hotel.
Thanks for catching those, Jeff. I appreciate it. Next question is for Judy and Rich. The question is, what is the accuracy level of the testing being used?
Rich, all right, go ahead.
Sure. This is highly accurate, internally verified and externally verified against both positive and negative samples at the 98.7% sensitivity and nearly that same level of specificity, which repeatedly tested both again internally and by external labs has been confirmed.
Thanks, Rich. Julie, I'm going to come to you. Will faculty accommodate when students are sick or in quarantine throughout the semester?
Yeah, I think students know that the attendance policies and so forth are the purview of the individual faculty members. They should be, certainly we've suggested and recommended that they review those at the beginning of the semester, so again, everyone is clear. We've also really encouraged faculty to be more, accommodating is probably the right word, for absences that students may have, particularly since we've asked students specifically not to come to class if they have symptoms, or obviously if they're in quarantine. So I think that it is, we've certainly communicated to faculty that what the situation is and asked them to make appropriate adjustments. So I think you'll see a lot of very, very appropriate and very upfront interactions with faculty on this. What we always ask is if the student's going to be absent from class, the best thing they can do is to send the faculty an email and let them know ahead of time if possible, or let them know, what's going on. That's incredibly helpful when faculty have a context for what they're experiencing, what they're seeing. And students who are absent, they may, if they're in quarantine, they may feel fine and they may be able to participate fully in the class, and that would need to be signaled ahead of time to the faculty as well.
Julie, I have a follow-up question to that you may or may not be able to answer. This may be more appropriate for the provost, but since it was posted, what happens if a faculty member gets sick? Are you aware of any plans to teach those courses?
Well, again, it would depend on the individual faculty member. It would depend on the course. It would probably depend on how sick they were. Again, the thing that's interesting about this disease is you can have it and not really experience any real symptoms. And so faculty would be under this, they may be at home and be able to Zoom in and the class can go on. If that's not able to happen, we would do the same thing we always do when there's faculty illness and absence. The department really handles that. They may ask another faculty member to come in and teach the class. They may, if it went on for a good long period of time, we would have to find a substitute for that class.
Thanks, Julie. I appreciate you taking that question. Jeff, I've got a couple of move-in related questions. How many students will be in each move-in time slot?
Yeah, our planning right now, and actually Judy can speak to this too, about 30 students will be brought in every 30 minutes. Is that correct, Judy?
That's right, 30 to 40 at this point. So we can accommodate the testing.
And I'm glad you said that. Good segue. The next question is, do we move in first or do we get tested first?
No one moves in until they're tested. You come to the testing area first, and then you'll be signing a consent to be tested, and you'll have your test and quickly go through the building to where Residence Life is waiting to give you your key and all the materials that different departments have compiled for you during this process. So
great.
Testing first.
Great. Thanks, Judy. And Jeff, I got one more move-in question for you. The question is, we've heard a lot of information regarding the reentry to the dormitories. What about moving into a fraternity?
Yeah, good question. We are including fraternity move-in in with our residence hall move-in process. So students will be assigned move-in times just like we're doing in the residence halls. Testing, everything will be very similar, will be the same. We do have several fraternities that are privately owned. We are working with the privately owned fraternities to work with us on the same plan. So students moving into fraternity should have a very similar experience to the students moving into the residence halls on campus.
Fantastic. Thanks, Jeff. Judy, we're going to come back to you. At what point should students fill out the COVID-19 initial pre-arrival screening?
Well, we had asked that students start screening 2 weeks before they arrive on campus. So we're getting close. We're almost at 2 weeks, right? Or maybe we're even past that point. I don't know. Our calendars are hard. Today I was right. And depends on when you're arriving the 10th, you should be starting that if you're arriving a little bit later, but there's no harm. It's all open right now to anyone that just wants to start right away and get into the habit of waking up and doing your symptom check. And it's just essentially a good reminder for while you're home. If you're ill, if you have any symptoms, you really need to seek medical care to be evaluated or testing if that's appropriate, so that you have that information and that you're better before you come to campus.
Great, thanks. Folks, I've got about 5 more questions and then we're going to wrap it up. I really appreciate your time. Judy and/or Rich, are flu shots available this early since they are mandatory, and can students get them on campus?
I can take that. We've ordered over 1,000 flu shots to be available on campus. Are they here now? Not yet. So we will be doing, students will be able to get flu shots on campus, and we will be doing flu clinics starting as soon as they're available. Historically, we've done a clinic at noontime, and we've administered flu vaccines at that time. So anyone that's been here before knows it's kind of a lineup in what we had before. Now it'll be a lineup 6 feet apart to get your flu shot during that lunch hour and a half for at least 4 to 6 weeks, so that we cover that. Now, certainly if a student is able to find a flu shot, I don't know if there's any in our community yet, but we here on campus don't have them. But if you have them available in your community, you certainly could have a flu shot before you arrived on campus, and just give us some verification that you've had that flu shot.
Thanks, Judy.
Yeah.
Julie, this I think is a question for you, or maybe Jim Biesecker. Is the gym going to be open?
Yes, my understanding is the gym, the fitness center is definitely going to be open. Maybe Jim would know about the gym itself, but fitness center will be open, and in fact will be for students only during this period of time. So students can count on access. Jim, what about the gym and the gymnasium and the field house?
The field house is, I think it's on the same schedule as the fitness facility. So it may not open right at the beginning, but then Fieldhouse Courts will be open as the fitness facility opens. I think it's within the first 2 weeks.
Great, thanks. And Julie and/or Jeff. Jeff, you touched on this a little bit, I think, in your answer about gatherings, but the question is, will clubs and activities be able to meet this year?
Yes, they will be able to meet. There may be situations in which they meet virtually. There may be some situations in which they meet outdoors. We actually have purchased a new software program, and the title will be Engage Gettysburg, and it will provide information about what activities are going on that's very, very accessible. No more having to sift through the Gettysburg Digest to find out what's going on campus. And it will allow students to sort of identify the kinds of clubs and activities, interests that they have, so they can sign up sort of like affinity groups. And so we're looking forward to being able to introduce that to all of our new students. But yes, clubs and organizations will still be encouraged to get together and to sponsor activities, particularly looking forward to, obviously this is a very intense political time. So we know that the political groups will be definitely wanting to meet and host activities, as well as many others. Jeff, do you have anything you want to add to that?
No, I think that it's good. You covered it well.
All right, thank you. We're down to our last 2 questions, and Rich and Judy, I'm going to ask you to answer this as briefly as possible. I know it's going to be hard, but can you explain how contact tracing will work?
Sure. Go ahead, Judy.
Okay. I probably can. I can probably create a case scenario where we have a student in this first 2 weeks of testing, or 1 week, week and a half, becomes positive. Okay. Our turnaround, the student is tested. Our testing results will arrive at the health center, and we'll, as soon as we get the test results, we will be giving those to our case manager or our nurse practitioners to notify the student of their positive case. We'll initially make sure that student is moved to isolation and settled in a bit before he or she or they are interviewed as far as who do they recall being in close contact with. So that is, again, closer than 6 feet, longer than 15 minutes. We have to think about those scenarios. So I think that just our contact tracers have taken courses where communication skills have been strongly stressed, and we know it's a stressful time, and so they may ask initially, they may ask again, and just to acquire those names of people on campus that they've been in close contact with. The case manager certainly will be communication, as I said, with the parent or the support person to let them know, perhaps, maybe they would be considered close contact if they just drove 2 hours from New York or Philadelphia to bring their student here. So they would need to know that. But we're trying to keep it contained to our campus. The lab that we're involved with will be reporting to the State Department of Health, and that's a requirement on their end. We too have established relationships with the local Department of Health, so we will be working with them as well. So that's kind of contact tracing, is just sitting down with the person that's positive to say, think about where you've been, who you've been with, and the reason is to keep the community safe. And I think that relationship is going to be so important for us to do our job and keep cases contained on Gettysburg campus. But it will rely on some honesty with the student, and it may be a little bit uncomfortable to talk about, but the contact tracers will be, it's very confidential. Whoever's contacted in saying they were exposed or had close contact, will not be giving out the positive case's name, because that's breaching confidentiality. So I do think it's a relationship that's developed, one that has to be trusted on both parts. Trust that the student is going to be honest with his answer, and filling in the case manager, contact tracer, to go in and do her job in the best way that she can to keep the campus community healthy and keep it open. So
Thanks, Judy.
I think that's
Before we get to the final question, Julie, I've been informed there are a number of questions about going home during the semester and visitors. I'm happy to help answer this question as well, but I just wanted to see if you wanted to say a few words about both of those topics.
Well, again, this is something that unfortunately we are not allowing, certainly not encouraging. I think we are actively discouraging and telling students that we expect them to be here for the duration of the semester. And I think the reason for that is fairly obvious. So same is true on the other end, where we are not allowing guests on campus unless they are essential to the completion of the mission of the college. So I'll leave it there. But yeah, I think that answers the basic question, Jim.
It does. Thanks for clarifying that. We just got a number of questions about that.
Yeah, I understand.
Yeah. All right, last question of the day, and it all comes back to food, Pete. So how will you address specific dietary needs under the new dining protocols?
So students that are on special diets or restricted diets are encouraged to talk to dining services. Smart Eats will remain open, and that's where they have been accessing their allergen-free or special diets. It's very important that we work with the students. All of the chefs will work with the students and fill those. And there's really shouldn't be any change to that.
Great. Thanks, Pete. I want to take a moment and thank everyone for joining us. A special thank you to our panelists for their time and continued work towards our campus opening. For our audience, if you did submit a question and it was not answered, please remember to send it to fallreturn@gettysburg.edu. Our next student parent town hall will be Wednesday, August 5th at 1:30 p.m. and will follow the same format and cover the same topics. Therefore, you do not need to attend both. Enjoy the remainder of your day all, and panelists, thank you again.
Jim, can I just jump in for 1 second very quickly?
Sure.
Some of the questions that were asked today, I know are already answered, and perhaps in greater detail on the FAQs on the college website, Better Together. So I would encourage you, if you didn't get your question answered, please check out the FAQs. There's a lot of information there. We'll be adding to it, I think, based on the questions you all have been asking. But that is a dynamic site. So read it now and read it in a couple of days. I think we'll have more information on there based on your questions. Thank you, Jim.
Thank you, Julie. I appreciate you adding that note. Have a great day, all.